Hi, David with WheelItForwardUSA.org. Today we're talking about bathroom safety, bathroom benches, bathroom transfer benches. The most common needed bathroom assistant device is the shower chair. Shower chairs come either with or without backs, with or without arms. Getting the advice from a medical professional is certainly recommended. These particular chairs are adjustable in height. You can push the button to allow for the leg to adjust. You always want to look at the feet at the bottom of the chair, make sure that they are not worn, that they have a nice cupped view to them. When you are assembling the chairs, you want to make sure that the armrests are properly located. You do not want them to angle in towards the seat. They should angle out. A lot of times manufacturers make slight changes. It's always good to look at the instruction manual when you're assembling them properly. They do have nuts and bolts that come in different sizes. You want to make sure that those are lined up in the proper holes when you're assembling them. They are very helpful with the legs that go straight to get them inside the tub walls and add stability. A lot of times these chairs can be used either in a bathtub setting or a walk-in shower setting. Sometimes with handles is better than without handles. There are also wheeled shower chairs, which are typically used in a walk-in shower that has a smooth transition, no elevated flooring barrier between the bathroom area and the shower stall itself. Those are special configurations, and measurements of the environment should be made prior to letting someone take a wheeled shower chair. Those wheeled shower chairs also can include a commode option as well. The wheeled shower chairs make a huge difference if a person is transferred using a patient lift. It makes it easier for you to utilize the patient lift by transporting them, getting them out of bed or out of a wheelchair into the wheeled shower chair, and then using that wheeled shower chair to go down the hall or across the room into the showering area. There are many different types of chairs to use in that area, so again, going with the medical professional, OT, PT, is recommended to make sure that the chairs the patient wants is going to be safe for them to use. The next step up for somebody that has trouble transferring, but it can still have some mobility, would be a transfer bench. This one's called a 3-panel transfer bench. It's designed to sit half inside the tub and half outside the tub. The handle part goes into the tub. When you're assembling them, the suction cups are put on the side that goes inside the tub. The way that they make these particular seats does make it universal. Knowing which way they enter the tub is important to know which way the shower head is facing. So that's an important question to ask. By making it universal, they allow for the person to change the back, which allows you to know which side of the tub it's going to go into. If you're getting new units, you definitely want to look at the installation manuals again to make sure that it's being properly installed. There we go. Once the unit is in the tub, you want to make sure that you take care with the suction cups. Trying to pull the unit up is not going to work well, and you'll pull the suction cup off. You need to pull on the little plunger that's here at the base to release the suction that allows you to pick up the part that's inside the tub. That's these little prongs that are on this suction cup here. The chair itself bench is adjustable in height. Oftentimes the tub height of the floor is higher than the actual floor height of the bathroom. So when you're adjusting this, you want to make sure that this side is lower than the side that sits outside the tub by adjusting the leg length. This allows for water to stay inside the tub area. You can also get an inexpensive plastic shower curtain And by cutting 2 slits in the shower curtain, you can wedge it in between the crack here so that while the patient is in the shower area, you create a barrier to reduce the amount of water that can fall out into the regular flooring, which would be a slipping issue. The use of this once the patient is on the bench itself, if this was the outside area of the bathroom and the tub is here, you would bring the patient over to sit on the first panel. That's the reason for the suction cups. It allows the unit not to tip while the weight's coming onto the bench. You would swing the legs over the tub, and then a lot of times you'd help them to slide over, which is what this handle helps for as well. When you are seated in this position, the shower head is now directly in front of you, so you should be able to make sure that that's the proper way of locating the inside edge versus the outside edge of the transfer bench. Sometimes the patient can't help you to slide in and out of the tub. They also make what's called a sliding transfer bench. The sliding transfer bench comes with a seat that moves. The way this is set up now, you can see that it's set up for the higher tub floor to be on this side. These particular seats are designed to allow the patient to enter the bathroom area. This side is sitting on the outside of the bathtub wall. The person sits down. You can then release the chair, which allows you to pivot. And once they get into the proper air position, there's another lever here that can be depressed, and it allows the chair itself to slide into the tub area. What that allows is the legs to sit here until the caregiver can get around to the side to lift the legs up and over should that assistance be needed. They are now situated inside the tub. Again, you can take a inexpensive plastic shower curtain. You can cut 2 slits up the side of it and put it down here so that you now reduce the amount of water, and that gets tucked inside the bathtub wall, and that now allows for less water to get a splash out into the regular standing area of the bathroom flooring itself, reducing slipping risks for the caregiver. Some do come with a tilt back arm that can also help with transferring the individual. You could use this tilt back arm as a means by which to use a sliding transfer board to get them from one wheelchair device onto this device.